Hi everyone, welcome back to the Well by Doula podcast. Today we're talking all things prolapse and tearing with a wonderful woman called Dr. Jess. I'm your host Barry. I'm a registered nurse, birth doula and founder of blissfulbirths.co. In this episode, I'm welcoming pelvic floor physical therapist and birth coach, Dr. Jess. Jess lives in Wisconsin, USA and has a business where she educates women on how to birth their babies in a way that protects their perineum and pelvic floor. I actually found her on Instagram and I loved her little bio, protecting your peach to birth a watermelon or something.
You got it. Yeah. So I'm glad you noticed that because I wanted to put something there that was kind of funny in the way we all kind of talk about this. Like, how am I going to get this thing out of something this size with minimal impact, right? And so there it was, peach and watermelon.
I love it. It's so good. She's woken up nice and early to be here. Actually, it's only 8 o'clock for her, but that's nice and early for me. How are you going this morning, Jess?
I'm doing really well. I got my daughter off to school at 7:30 and I'm just really excited to be here.
Amazing. I'm very excited for our chat today. Do you want to tell me a little bit about you? Do you have children? Like, what's your life look like at the moment?
Yeah, so I do. We have one daughter. She's 10 years old. She's in fifth grade. And my partner and I run a small physical therapy clinic together. I get to show up and do all the fun stuff of supporting and educating clients, and he gets to do all the boring stuff like the back end billing and scheduling and Excel files, and I get to just do the good part. So it's a nice
do the
balance.
fun stuff. Yeah. What was your birth experience like with your daughter?
Yeah, so I went into my pregnancy as a physical therapist, orthopedic physical therapist, which is, basically head to toe and taking care of shoulders and necks and knees and sprained ankles, and felt like I was a quote unquote expert in the biomechanics and joints and muscles of the body, and thought I had this whole birth thing kind of figured out. And on the other side of my birth experience, I realized that there was a lot I didn't understand in terms of the role of the pelvis and the pelvic floor during birth. And I took a massive deep dive into the world of pelvic health and became a pelvic physical therapist so that I can provide this information to people now before their births. So I do a lot of supporting of people in the postpartum period, which I adore. However, my passion project now has been getting this information out there before the first birth.
Yeah, exactly. It's so important. And I think that we're not educated enough. When you don't know a lot about pelvic floor, you are always taught, do your Kegels, that's going to strengthen your pelvic floor, and strengthen. But there's also the other end of the spectrum. Some people have weak pelvic floors, some people have super strong pelvic floors, and that doesn't help them either. And it's not all about strengthening, it's also about relaxing. And your pelvic floor has to be relaxed to let the baby pass through, and it has to be strong to protect you after the birth. Is that right?
Yeah, that's exactly right. And I think that Dr. Arnold Kegel in I think the 1940s or maybe 1950s made some really great contributions to the understanding the pelvic floor, but it is now 2024 and we have moved well beyond Kegels. And so, yeah, that's exactly right. Depending on where you fall on a spectrum of your pelvic floor health, you may need to do the opposite of Kegels in order to get your needs met. So something that's really interesting, just to explain this a little further, somebody who may have urinary incontinence, so let's say they pee when they sneeze, that may be happening for two very different reasons. It could be a weak pelvic floor. It could be an overactive pelvic floor. And so depending where they fall on that spectrum will depend how we actually successfully treat that. And it's the same thing in pregnancy and for birth and post.
Yeah, exactly. So what we're talking about today is tearing and prolapse and how to prevent that and protect your pelvic floor and perineum. And it seems like there's just super common problems nowadays. Like 1 in 3 women have a prolapse, which is crazy. That's such a huge number. Why do you think that is?
Yeah, and I think there's a couple of things to talk about here, potentially. I think that we're becoming more aware of pelvic health conditions and symptoms. And I
Yeah.
think these things are getting maybe diagnosed a little sooner, whereas maybe before they weren't really getting diagnosed and we were suffering in silence. And so I think there's
Yeah.
that awareness. And, people are being really proactive now with their pelvic health and seeking diagnoses and resources. And so that could be part of it. And also, my opinion is that birth has become really medicalized. And I think
Yeah.
that because of certain things around birth culture, it might be contributing to that.
I always say this, the hospital is great, but not for every birth. If you are healthy and your baby is healthy, it's actually quite unsafe to go into a hospital for a normal birth. And it's there for the case where something goes wrong. And what we don't realize is that doctors are wonderful at what they do, but they are specialists in everything that can go wrong. So they preemptively do things. And that could be like, oh, the baby's stuck, we need to use forceps. The baby's stuck, we need to give you a episiotomy. And episiotomy is starting to become more standardized, which is terrible. There was a study done in Australia that like 30% of episiotomies, some crazy number, they did not get consent before they did the episiotomy,
Oh
which
my gosh.
is,
Yeah.
that's terrible. That's illegal. That's, I don't even know what to call that.
Well, I mean, I think the term for that, anytime you're not getting informed consent, would be considered a form of obstetric violence. And I think that
Yeah,
that is
exactly.
becoming more and more common under the medical model
Yeah.
because you're right, the medical model kind of frames birth as your pregnancy and your birth is potentially dangerous. And so therefore, we need to intervene to make sure that it stays safe. And it's that
Yeah.
intervening that can sometimes impact healthy physiologic birth.
Yeah. Yeah, 100%. So what are the most common causes of tearing during birth
hmm
that
Yeah,
you
where do
know
we
of?
start? Well, I think that an easy place to start would be the fact that we're using a position to birth in,
Yeah.
which really makes zero sense if we're being perfectly blunt. So, that standard and most common birth position, which is called the lithotomy position, which is where you're on your back and your knees are pulled wide to your chest, or somebody's holding your knees wide to your chest, or maybe your feet are in stirrups. But we know that that's the exact opposite position that the pelvis needs to be in when baby's exiting the body. And
Mm.
so, because of that, I brought my pelvis home from the
I
office.
love that.
I brought two of them actually. So these 4 points of the pelvis here, we call this the pelvic outlet. This is where baby is passing through the pelvic floor and exiting the body. Well, when we come into that position on our backs with our knees wide, pulled towards our chest, that diamond of space actually physically narrows. So that's
Mm.
a smaller space for baby to navigate, which means we may have to push harder and for longer. The other thing is that the tailbone can move out of the way about 16 degrees during that process. And sometimes if we're on our back, the bed is going to block that. And then I think
Mm.
the third critical thing about this is we are pushing uphill. So all these parameters might contribute to needing to push for a lot longer and pushing a lot harder than we
Mm.
would if we were just like using gravity, opening the space and, letting the uterus do the job of pushing the baby through the pelvic floor.
Yeah. Yeah, exactly. Yeah. That good old view of birth that you see in movies where they're on their backs and the midwife is going, push, and the mum's just screaming out in pain and looking really distressed. That's not how we
Right.
should be birthing our babies. We should be moving. The number of videos that you have on your Instagram, they illustrate it so well, the kinds of positions that you're supposed to be in during birth. And the next question is, what are some specific ways that women can prevent tearing during birth? It's positioning. Correct me if I'm wrong. Positioning is a huge factor that can
Yeah.
prevent you from tearing. I know for a fact that water and perineal massage can also help with
Mhm.
preventing tearing, but positioning is huge. It can prevent tearing, it can help the baby move down into the pelvis and move out, and the baby rotates as it comes out, so that can facilitate that.
I think that's spot on. I think if I were to simplify the way I'm educating clients, I would say three things are important: that you want to free your tail. So we want that
Yeah.
tailbone to be free to move out of the way so things open up. You want to make sure that if you can, you're using a little bit of gravity and that pressure is off like major arteries. And
Yeah.
so that's typically like a more upright or vertical position. So we know based on research that very specifically hands and knees positioning is known to reduce your risk for tearing. And then side lying is a second best option. It's not using gravity, but is a second best option, especially for someone who might have an epidural.
Yeah. Or if you're just really exhausted, you've been laboring
If
for
you're
a long
really
time.
exhausted.
Yeah.
Yeah, and that's a great point because one other thing I'll add there, I'm glad you said that because also if this isn't your first birth and baby's exiting really quickly, sidelining is a great way to slow that down to help protect the
Yeah.
perineum. Yeah.
Yeah. Yeah, slowing it down. People think that, oh, the baby's coming quick, push. The studies show that if you slow the down, breathing through the urges to push rather than actively pushing when you feel the urge, and letting your body just do the work allows the stretch and make way for the baby's head, because it is like birthing a watermelon. Exactly. You can't just push it out and expect that there's not going to be any tearing. All those muscles and the skin down there is very stretchy, and you just have to give it time to stretch. And what I was saying before about movement, it can also reduce pain. That's the other thing that I was going to say. Yeah. So perineal massage, do you teach that to your clients at all?
Yeah, so I think that yes, and I think there's a little more that I like to talk about around perineal massage. I think a lot of times we teach people that we're stretching the perineum, and I
Yeah.
don't necessarily believe that's what we're doing with that, but I do believe there's a lot of value for people who are interested in doing perineal massage for kind of a different reason. One of the things that I spend some time talking about is breath work and how to connect that breath work to the pelvic floor, not
Yeah.
only during the entire active labor, but also when you do get to that pushing phase. And
Yeah.
so when you can do a little bit of perineal massage and practice that breath work of keeping that pelvic floor and open and release, even in the midst of that stretch pressure, right? If you can practice that, you create this really nice pathway and this mind-body connection that you can then draw on a little more naturally during the birth process. So I definitely see some value in it, and I definitely think that for people who are interested, they can and should incorporate it. And I think it's all the other things we're talking about as well as these layers of what are all the things we can do to prevent
Yeah.
perineal tearing.
Yeah. Yeah. I mean, have you heard of the phrase floppy face, floppy fanny?
I've never heard that term specifically, but I know exactly what you mean. We say, what do we say? Loose lips for loose hips. And I think that's kind of the
that's,
same.
that's a bit
But
more PG.
I love Floppy Fanny, and I'm using that one from here on out.
Floppy face, floppy fanny. I don't know where it came from. I think I was
Yeah,
watching, like, there was this doula that I was following, and I think she just, like, put it out there in every
I love
post. And
it.
she always, in all of her videos, she always said floppy face, floppy fanny. And I mean, it just sticks. Like, it definitely did not leave my brain, you know?
Yeah, I love it.
But it really illustrates really well what happens. Like, for the people who don't know where the perineum is, do you want to just
I
quickly
have
explain that?
I have a pelvic floor. Pelvis number
Get out the
two.
pelvic floor again. Oh,
Yeah.
yeah.
Um,
Amazing.
so yeah, so basically everything you see here is red, and red is pelvic floor. And then there's this second kind of deep layer in the bowl, bottom of the bowl of the pelvis as well. And so the perineum, we think this is just like skin right here between the vagina and anus, but this is actually a really thick, strong muscle and a lot of other muscles attach into here. So it's kind of like I use this analogy. I have so many analogies, but I use this analogy of the perineum is like a load-bearing wall, and that we want to protect that load-bearing wall because it provides so much structure and stability to everything else above it. And so this is often where perineal tearing can happen. There's different grades of being minor to more severe, which would reach through the anus. But I think it's important to just also note that tearing can happen really anywhere in these muscles. So it can happen
Mm,
vaginally, it can happen into the labia, it can even happen around the urethra and the clitoris as well. And so, and then of course
mm.
into the anus. So tearing, can happen at places outside of the perineum.
Yeah, yeah, perfect. For those people who can't see the diagram because you're listening on Spotify, I'll make like a little clip of it on
Perfect.
Instagram so that you guys can see it, because that was a really well-rounded way of
Good,
saying it.
good.
And what I was going to say about floppy face, floppy fanny, I don't know the proper information around it, but there's a connection between the tension of the jaw and what's happening downstairs.
Yeah, that's exactly right. Yeah, so there's actually, so you know how we talked a little bit about I'm trying to get people to connect to their breath to affect their
Mm,
pelvic floor in a positive way during labor and during birth. And the truth of that is that starts all the way up here in the throat, in the jaw. With the glottis, the respiratory diaphragm, and the pelvic floor, those three things are really important that we have those connected. So a lot of times we will teach more of an what we call an open glottis or an open throat pushing because we know that reduces your risk for prolapse and perineal tearing when we could do in this way. Closed glottis pushing, which is where you close your throat, tuck your chin, and you bear down as hard as you can for
yeah.
5, 10 seconds, sometimes for an extended period of time. That is a lot of downward pressure basically on your pelvic organs and your pelvic floor. And so by keeping the throat open, by relaxing the jaw and the lips, really everything, the neck, the shoulders, by making sure you're keeping that throat open and exhaling some of that air. And even making low moaning, groaning, humming sounds are all connected with how we want to release your pelvic floor
Yeah.
during the birth process. So, a question you had asked earlier is what are the things we can do to reduce tearing? I would say this open throat, open glottis pushing is a really great thing to be familiar with and practice. And just know that sometimes you'll be encouraged straight off the bat to do closed glottis pushing. And so just having a plan in place that you want to try something a little different.
Amazing. Very well explained. Thank you. Going back to the question of how to prevent tearing, immersion in water softens everything in the perineum and allows for more stretching. Do you talk about this with your clients at all?
Yeah, so we unfortunately, where we live, some of the hospitals allow for laboring in the water, but not birthing in the water as
Oh,
of right
okay.
now.
Yeah.
Some of the hospitals do. And then, of course, I support a lot of people who are birthing at home with their midwives and can do whatever they want. So yeah, we do talk about this. And I think you're exactly right that warm water just helps with the stretchability of the pelvic floor. And that is probably why some of the research shows us that water reduces your risk for tearing. And something I was looking at this really recently and putting it together in an Instagram post. And some things that I thought about was, well, there may be other reasons why that's helpful too. And I think being in the water just automatically promotes a more upright position, just
Yeah.
naturally. We're not lying
Yeah.
on our back with our knees to our chest in the water. I think that potentially providers are just more hands off because
Yeah.
it's not easily
Exactly.
accessible. I
Yeah.
think there's probably reduced risk for episiotomy and vacuum and forceps assist. And we know
Yeah.
all those things increase your risk for tearing. And water just maybe naturally is a protective barrier from some of
Yeah, yeah, exactly. And also, it depends on how much you fill the bath up. you are also taking that strain off your legs. You're not standing up so much. You're
Yeah.
more relaxing in the water and letting the water carry you. It relieves the body of all that tension of having to stand up and bear this weight. Another tool that I wanted to quickly touch on, and I love talking about this, is the Birth Sling. Have you heard of the Birth Sling?
Tell me about this. I don't think I have.
It's amazing. There's probably some other version of it in the US, but it's by this Australian lady called Dr. Jess Michaels, and she's an osteopath. I had her on the podcast. I recorded one of my first episodes with her, which was amazing. She spoke about the Birth Sling. It's basically, like silks. Like you can
Yeah.
hang them from the ceiling and like hang off them. It's kind of like that. She developed this thing called the birthing sling. You put it over the
Right.
top of your door and you just hang off it. There's some bits that you can hold onto with your hands. You can like lean front ways so it's across your chest, or you can squat all the way down low. You can use it when you're in the bath. And it also protects the birthing partner because you're not hanging off them all the time. You're rather hanging off this birth sling, which is
Yeah.
really amazing. It promotes movement and just makes it a little bit easier. Definitely look it up because it's
Yeah, this is
something that,
amazing.
yeah.
And now that you mention that, I remember seeing a really great video of someone who was trying to get baby to engage into the top of the pelvis. And they were doing a certain movement with their spine and their pelvis to help open that space. And they were using something hanging that looks like a silk. And that's exactly what
Yeah.
that was. So I'm
Yeah.
really glad to learn more about that. It sounds like
Yeah.
it's super helpful for your comfort measures too, right?
Yeah.
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 hmm
Definitely. And yeah, it just keeps you out of bed also. Like I
Movement.
promote, yeah, I promote just following what your body wants to do. Obviously, if you do need to get into bed and rest for a little bit, by all means.
Absolutely.
Peanut balls, bouncing on the exercise ball, lying yourself over the exercise ball, anything to help you relax but still stay moving. The number of times that I've heard mums come back and say, my tailbone was bruised for months after my labor, and I'm like, oh gosh, you've
Yeah.
been laboring lying on your back. Yeah. Talking of positions, are there any positions in labor that can help to reduce tearing?
Yeah, I think like we talked about, the water is great. So if you have access to that and interest in doing that, that could be worth considering. From the research, what I can glean, and just from talking to thousands of clients now who've gone through birth, hands and knees seems to be such a protective pelvic floor position. And I think there's a lot of reasons for that, being the big three. The tail is free. We're using gravity, and of course, we're not putting pressure on major arteries. So I think that that one just seems to be a clear winner. And there's a lot of modifications and variations of the hands and knees. You can even do some version of that in the water.
Mm.
And although this is less common, certainly depending on the density of an epidural, depending on your plan and your birth team support, there are options to even get in hands and knees sort of modified supported positions, even with an epidural.
Mm.
So that could be something to do some research on if that interested you. There's lots of pictures of exactly how you could do that
Mm.
online. But like I said, it does take some pre-planning and conversations and the right birth team to help get you into that position.
Yeah.
And then, oh, did you want to add something?
I wanted to say that's such a huge misconception about epidurals. The fact that I'm getting an epidural, I'm not going to be able to move. I'm just going to be lying down on my back or on my side, whatever. It's not true. It's harder to move, but you can definitely ask people to help you to move into a position so that you are not just lying on your back, on your tailbone. So yeah, I just wanted to say that quickly.
Yeah, I think that is a really common misconception, and I see that a lot when people are engaging, especially on social media and asking questions and just saying, in summary, something like, but if I get an epidural, that choice will be taken away, right? And I just want it to be really clear that at a minimum, that sideline position is a great option too.
Yeah.
And
Yeah.
for people interested in moving even more than that and getting on hands and knees, it could be an option. But it's not something that you can say you want in that moment, right? It's got to be part of maybe a bigger plan, especially for those in a hospital base.
Yeah, exactly. Plan B and plan C.
Yes.
It's always good to have extra plans just in case plan A doesn't go to plan. I did see a position that I kind of wanted to talk about on your Instagram the other day. I don't know how to describe it. It's like a proposing position. One knee up, one knee down almost. I don't know how to describe it.
Yeah, kind of like a kneeling, but it is a
Yeah.
proposing position. I love it. Down on one knee.
So what about that position? How does that
Yeah,
help?
I think that could be especially for someone maybe in the water or somebody needs a little more of a rest versus like a standing or a semi-squatting position. But essentially just like that upright position, keeping that tail open, these are all such important and
Yeah.
critical pieces of these birth postures.
Yeah, definitely. All right, another big question. What about the size of the baby? The number of times that I've heard, I had a big baby, I needed to have a cesarean because the doctor said I had a big baby.
Yeah.
Or, oh, I tore because I had a big baby. Like, I've heard also some really great stories, really inspiring stories of this woman who did not tear one bit and she gave birth to a 10-pound baby. How does the size of a baby, particularly a big baby, quote unquote,
Mhm.
affect your chances of tearing?
Yeah, well, I want to start by saying evidence-based birth has a really great resource, very comprehensive, many pages within this resource on the evidence of big babies and needing inductions or needing cesarean birth. So I would direct people there to evidence-based birth. And I think the title is What is the Evidence on Big Babies? Is the name of it.
Yeah.
And so I would say this, there are some factors, there's some risk factors for tearing during
Yeah.
birth that can't be controlled for.
Yeah.
One of them,
Definitely.
based on the research, happens to be a big baby, and I think that cutoff is 8 pounds, which to me is not that big of a baby when I've had somebody with almost an 11-pound baby and birthed vaginally and had a grade 1 tear. So I think there's so much more to talk about here. I think that one of the things that's really important to understand is that the pelvis, the bones of the pelvis, drastically move and change their shape and position as a baby's passing through. And so knowing that and knowing how to work with that, depending on where baby is in the pelvis, can be a really valuable tool for helping people who've been told they have big babies to be able to navigate baby through that space. And then the other thing I would say is the pelvic floor muscles, including the perineum, can stretch 2.5 times their normal length. So another analogy I like to use is taffy. And when I say taffy, because I think what I mean by taffy and maybe what the rest of the world means by taffy is something different. But when I say taffy, do you think of the stretchy candy?
Yes.
Okay, so when I think about using that analogy, it's like, we need this really slow, steady stretch of this taffy, and it will do that stretch. The environment allows that to happen. And so, when baby's passing through there too hard or too quickly, or because someone's yelling push, or because the pelvis isn't in the most open position, these are also variables that can increase risk for tearing. And so sometimes I don't think it's just the big baby. I think it's
Mm.
some of the other factors that can be controlled for. And so,
Yeah.
right, we have the things we can control. We can't control the size of the baby, but then we have all these other things that we can, and just trying to understand what those are and stack the cards in your favor for those controllable.
Yeah. Yeah, definitely. Your body will not grow a baby that it cannot birth. Unless
Yeah.
you physically have a condition where you have a small pelvis and you've been diagnosed with that, your body is capable of birthing the baby that it has grown. And I mean, unless you also have gestational diabetes that has not been controlled, of course, you're going to be growing a big baby if that's the case most of the time. And you are stronger than you think. You are capable of doing this. It comes back to, rather than actively pushing the baby out and bearing down when your body is telling you that you need to bear down, breathing the baby out and using those low, mooing. I mean, if you've ever listened to a birth video or seen somebody birthing, you would have seen exactly the sound that I'm talking about. And that, allows the baby to come out slowly rather than pushing really hard. My sister-in-law had a very, very, very quick birth, and always think about this when I talk about breathing the baby out. And I said to her, like, did you breathe the baby out? Because when you're in the moment, you kind of just in the moment, you're there doing it, and sometimes you're not really thinking about what you're doing. You're just like, get this baby out of me. And yeah, she ended up with some tears and grazing. But yes, the baby pretty much just shot out of her,
Yeah.
for lack of a better word. And then there's also the phenomenon of the fetal ejection reflex, which is out of our control.
Yeah, and I think that, that's a really good point is like waiting for that fetal ejection reflex, because by the time that's happening, it's most likely that the pelvic floor tissues have been primed already for baby to pass through. But I do think it's important to note that a lot of times that fetal ejection reflex is absent with an epidural, and you may or may not be able to wait for that spontaneous urge to bear down. And I think that's a critical difference between medicated versus unmedicated.
Yeah, definitely. Right, we talked a lot about tearing now. Now it's time to talk a bit about prolapse. So what is prolapse? What happens when you have a prolapse?
So the organs of your pelvis include your rectum, the uterus and cervix, and the bladder. And what happens is those organs can shift their position in the pelvis slightly or more severely, depending on the grade.
Yeah.
So sometimes what happens is the rectum shifts its position and pushes into the back wall of the vagina, or the bladder shifts its position and pushes into the front wall of the vagina. And then the cervix obviously can drop down into the vault of the vagina. And oftentimes people tell me it feels like pressure, it feels like heaviness, it feels like something's there that doesn't belong. A lot of times people will say, I feel like I have a tampon incorrectly positioned, but I know I'm not wearing a
hate
tampon.
that feeling.
Yeah,
Yeah,
it's the worst feeling.
I know that feeling.
Yes. And some other signs may be that they are having difficulty keeping menstrual products in or keeping them in the right position because of the pressure into the walls of the vagina. And yeah, so it's this general kind of heaviness and falling out feeling. People can sometimes see or feel with their hand a little bulge or something just visually being off as well.
Yeah, I mean, I said this in the pre-show. My sister, I was talking to her recently about babies and giving birth, and she said, oh yeah, I'm just going to go and have like a cesarean because I'm really scared of prolapse and tearing, and I know how common it is. How can a woman prevent prolapse?
Yeah. I think you brought up some really good discussion points around this. And one thing I'll say very quickly is a cesarean birth will, yes, help protect the pelvic floor from tearing, but, and this is a surprising fact, it actually doesn't mean that you won't have other pelvic health and pelvic floor symptoms and concerns. And the reason that is because the pelvic floor is one small player on a bigger team of your core system, including your breathing muscle and your abdominals. And it's like this balloon between these three different muscles, with your pelvic organs and your abdominal organs being on the inside. And so sometimes you can have pelvic health symptoms, let's say incontinence or prolapse, and pelvic floor isn't even the one that's at fault for that, right? We're looking at diastasis recti, which is the tummy muscle condition, or we're looking at the fact that there's some pretty deep scar tissue through the front layer of that balloon, right? And so all these three things in the system have to coordinate and communicate for us to have good pelvic health, for us to not have hip pain or back pain. And so a cesarean birth isn't this free pass into not having pelvic health symptoms. And I think that that's a really common misconception that, yes, of course, you're not going to have a tear during birth. but that's one protective factor. And so we're just trading off maybe one for the other.
Yeah. Yeah, and you also have one hell of a recovery
Yeah,
after having major abdominal surgery. There is definitely a time and a place for
absolutely.
cesarean section, but the rates of
100%.
cesarean section are through the roof, and something crazy like $27 million was spent just on cesarean sections.
Yeah, I
And that's
believe
a
that.
huge amount of money.
Yeah.
So,
Yeah,
yeah,
well,
definitely.
and then Barry, you asked too about the second part of that discussion was preventing prolapse. And I think that based on what I understand from the research is one of the biggest risk factors is that purple pushing or that closed throat pushing, especially if we're going to be doing that for an extended amount of time. I think it's the risk of prolapse goes up for pushing greater than 1 hour, which is quite frankly maybe every first time birther. So, if we can limit that excessive pressure that's being pushed down onto those pelvic organs. And then I think there's a lot of things to consider in the early postpartum period just to protect that newly vulnerable pelvic floor. And when I say pelvic floor, I do mean the muscles, but I also mean the organs that are sitting on that floor. So it's kind of all of
Mm, mm,
and so, just a quick few things there. I think one of the number one reasons from my experience and the clients that I've supported postpartum, the number one reason they're coming to me for symptoms of prolapse is because they got constipated and were
mm,
bearing down for an extended period of time, many days, maybe even longer, and now they have things that feel bulgy in their pelvis. And so, really making sure early postpartum that your bowels are moving well and just other really simple things like you're breathing well, you're not holding your breath if you lift something. Also, the recommendation, and this is runners always hate when I say this to them, but the recommendation is waiting till 12 weeks postpartum before returning back to any impact or running
yeah.
activity. And that's a long
And
time for people to wait because we're told at 6 weeks that we're good to go, at least
yeah,
here in the States.
definitely in Australia. Everybody's like, I'm six
Okay.
weeks. I can go back and exercise now.
Uh-huh. Yeah, and that's partially true, except we want to slowly build back into that higher level of fitness and exercise. So,
Yeah.
and that's a piece that gets missed because there's not a lot of guidance about, an evidence-based approach to protecting your core and pelvic floor when you're returning to fitness at 6 weeks.
Yeah. I think we get so used to just being capable of doing things for
Yeah.
ourselves. And
Oh,
then when
yes.
we have a baby, and then we have to be like, honey, can you pick that up for me? Or like, honey, can you carry this for me? You feel like you're just like a passenger princess or something.
Totally. I love it. I love it.
And you just feel almost like just silly.
I mean, it's so vulnerable.
Yeah, you feel vulnerable. I'm a fully grown woman. I've just birthed a watermelon out of my vagina, and I can't even just go and pick up that one thing that's just slightly heavier than my baby, which means that I
Right.
can't pick it up.
Right.
So I definitely
Yeah,
understand
it's a
that.
it's a big shift for reintegrating into a postpartum body. That is for
Yeah.
sure.
You just have to remember that you did just go through something major, and your body needs time to recover. And you are a superwoman, and just because, you take that 12 weeks off and you just let your body get back to it slowly, that's what you're supposed to be doing. I definitely will be having some trouble myself
Yeah.
with that because I am so independent. I know, like, right now that I will be having trouble.
Yeah, and I think that struggle is real. Yeah.
Yeah, somebody will definitely have to remind me to slow down. What are some early signs of prolapse that women should look out for?
Yeah, I think the biggest one is just that feeling of heaviness, pressure. It's I've heard it described as a like feels like something could fall out
Yeah.
feeling. You may be having changes in your bowel or bladder health that could indicate a prolapse. And again, I've had someone recently tell me it feels like there's just a little rock sitting in my vagina that doesn't belong.
That's an interesting way to put it. I could
Yeah,
definitely
so it's
visualize
that
that.
yeah, can't you just kind of feel that right now? It's just kind of this
Yeah.
little bit of a heaviness, this pressure kind of down
Yeah.
into the pelvis.
Yeah, definitely. What role do birthing partners play when preventing the risk of tearing or, prolapse.
Yeah, I think that, these discussions about what these controllable risk factors are ahead of time are really lovely, making sure they're in the birth plan, making sure that they are followed. That's a great role for the birthing partner is, let's
Yeah.
say in a plan, the person wants to try open glottis, open throat pushing, and they're being cued to close their throat and purple push. The partner can say, hey, we practiced and know about this other strategy. We'd like to try this first. And just kind of be
Mm.
an advocate for you. They can also just help keep, if somebody says, I don't want an episiotomy unless it's absolute medical emergency, they can kind of keep an eye out for, anything coming near the perineum, particularly scissors.
Yeah, when they take those scissors out, that's your cue.
Uh-huh. And then another really interesting one that I'd love to share is that you, as the person giving birth, or your partner, or a doula, or the actual midwife or doctor, could monitor the perineum. And so one of the things that happens is if that taffy looks like it's a little too taut and maybe starts to blanch, so it loses color, it turns white, that might be an indication that there's too much pressure passing through there right now, and maybe to go back to the loose lips or just kind of some breath work rather than actively pushing.
Mm.
And then once it looks like that's kind of loosened up, there's a little give in that taffy, maybe it's got its color back, and then that could be an indication of like, okay, you're good to go a little more with that.
Mm.
Because
Mm.
when we look
Yeah.
at the midwifery research, particularly research around home birth midwives, we see that they have exceptionally high rates of their clients having intact perineums. And
Yeah.
one of the things that we glean from that research is that there is a very calm and controlled environment when baby's crowning, that maybe they're monitoring the color of that perineum and kind of giving some feedback based on that. They notice that maybe the active pushing stops during a contraction,
Mm.
and that baby's head there is there for an extended period of time. Maybe I think it
Yeah.
says something like 5 to 10 contractions. And so these are all things too, if a birthing partner knows this ahead of time, can really help maybe just give reminders or help facilitate.
Yeah. Yeah, definitely. Have you read Ina May Gaskin's books at all?
Oh yes, one of them, spiritual midwifery, was I found it. Actually, my partner found it at a garage sale. He had no clue who she was or what she was. He found it at a garage sale and he handed it to me. He said, "I don't know why, but I think this would be something you'd enjoy reading." And he was so right. Yeah,
It's that book in particular.
yeah,
Love it. Like, okay, it's like when I first saw it, I was a bit like, I'm a registered nurse as well as a doula, so I know both sides of the coin.
yes,
I'm
you do.
clinical, but I'm also very, holistic based and holistic minded. But even just the title of spiritual midwifery, I was a bit like, is this going to be really like spiritual, hippy dippy, woo woo stuff?
Woo woo,
And
yeah.
it wasn't, it's like amazing, it's beautiful. But anyway, what I was going to say is I can't remember which book it is, whether it's Guide to Childbirth or Spiritual Midwifery, but she talks about in the birthing stories of each woman, sometimes that the midwife will almost like help the head come through. If there's like an anterior lip, they'll aid the baby's head through by tucking the anterior lip or holding the head in just a little bit so that it gives a little bit of relief for that perineum
Right,
stretching. And in saying that, that is an intervention. People
right.
think, oh, intervention's like something like an injection or an episiotomy or epidural, that extreme. But it could be something as simple as somebody talking to the mum. That is an intervention. That interrupts her birthing, her bubble, and going in there and touching that very sensitive space and area can really affect the woman when she's birthing, but it can also help. So like, obviously, if you are going to be doing that, asking permission, letting the mum know, I'm just going to help you out here a little bit. Keep going. You're doing really well. I'm just going to put my hand here, so that she's not just surprised of, oh my God, somebody's just touched me in a very sensitive area. But that can help. And even telling the mum to do it to herself, so that you're not disturbing that
Yes.
bubble. Telling the mum to put her hand down there and, feel the baby's head and hold it in. If she's having trouble breathing through that contraction, it looks like she's going to tear. And also something that you said earlier about the birth partner advocating if you are in hospital. Sometimes if you, as the birth partner, or you think your birth partner doesn't want to be in charge of that role, advocating for you, somebody who's really, really useful in that area is a doula, and or a private midwife. If you do have a midwife, they can come into the hospital with you sometimes. I'm not sure how it is in the US, but I know how popular doulas are in the US. I have quite a good network in the US, and the birthing world is so different in the US to Australia and New Zealand and the UK. But yeah, even having a doula there can really, really help. And it just gives the partner a little bit of a break from having to advocate for the mum and worry about, making the wrong decision, because that's huge. If something happens and the woman, all of a sudden the doctors are saying you have to have an emergency C-section, and to sign off on that and not giving any informed consent or anything like that, it can happen really fast, and the dad or the birthing partner just sometimes does not want to make a mistake and be held responsible for that. So a doula can be really good in that moment where a decision needs to be made, and you need that little bit of education in layman terms, because the doctor's just speaking in jargon and you're just like, I have no idea what you're saying. So yeah, I just wanted to say those two things. But yeah, if a woman does experience tearing, what can they do to help with recovery? When should they see a pelvic floor physio or any of
Yeah,
that?
I'm actually glad you asked this question because I think there's a lot of important things to talk about here. And so one of the things I would say is if you can gather as much information prior to your birth about how to care for your early, vulnerable, sensitive postpartum pelvic floor, so you can have these things in place, you can have things ready like as soon as you're home, as soon as you're postpartum, the better. So getting that information ahead of time. I think that a lot of times here, especially in the United States, they tell people, oh, just wait until you're 6 weeks postpartum to see a pelvic physical therapist or a pelvic physio. And I think that I want to make a clarification on that we wouldn't do a pelvic exam until 6 weeks, until things were fully healed. But there's a lot of really early education and support that we can provide that can be extremely helpful to somebody who's having concerns or unwanted symptoms early on. And so a lot of times what I end up doing for my clients is I'm able to just see them via telehealth. So even they're in bed, they're there with baby, they're not needing to get up and get out and drive to come see me. But in that telehealth, we can answer questions and provide support, sometimes really early on postpartum. So
Yeah.
and then, yeah, at 6 weeks, I mean, I'm biased, but of course, I think everybody could benefit from at least a consult postpartum and just getting those pieces of education and support for how to care for the pelvic floor going forward.
Yeah. And I know that finance sometimes is a huge factor of why women don't come to see people like pelvic floor physios. Are your services sometimes covered by private health or
Mhm.
a government like a government scheme
Yeah.
or anything like that?
Yeah. So we definitely are able in our clinic to take some private insurances, which is makes it more accessible, of course.
Yeah.
And then we also have cash paying clients as well. And then I just want to say too is that there's a lot of really reputable online resources as well that aren't quote unquote physical therapy diagnosis and treatment that are physical therapy informed education and support. And sometimes that's a little more affordable than
Mm.
one-on-one care, or even if it's not an affordability issue, maybe it's an access issue, right? Is that the closest physio is an hour and a half away, or
Yeah.
whatnot. And so I think there's a lot of opportunity for some online support as well. And for those who can, I think it's great to also supplement that with one-on-one customized care. Like I said, if that's accessible.
Yeah. Do you think it's important to see a pelvic floor physio before you give birth so that you do have this information? Do you think it's okay just to see them after birth?
I think that my answer will be biased towards I would love for everybody to have one, maybe even two or three prenatal sessions, even if their
Mm,
pelvis feels good, even if they're
yeah.
not really having a lot of symptoms, to just cover some really helpful basic birth related stuff that can possibly have a positive impact on the birth experience so that maybe they need less support and less care postpartum. That would be my goal,
Yeah.
right?
Yeah.
I am absolutely wanting to support you if you've experienced a tear, prolapse, or having symptoms, and there's a rehab process for that, and people can generally do really well with that. However, if we can talk about all the things to reduce those risk factors prior to your birth, I think the better. So
Yeah.
I'm gonna lean
Yeah.
towards prenatal pelvic physical therapy.
Yeah, I mean, to be honest, I think it's good to see somebody or even just have a telehealth, like, or seek some resources online, anything like free, paid, any resources to get your hands on it so that you can prevent rather than treat it once it's already happened. Because people, they tear and they never have the same sex life again. They have prolapse, same situation. They can't, we've all heard of I've had my baby and now I'm urinary incontinent. When I run I pee, when I laugh I pee, when I cough I pee. And it shouldn't be like that, you know? So,
Yeah.
like, to me, that is so valuable and it's worth the money because your body will never be the same if you do happen to tear. And some are worse than others, but, if you can do something to prevent that from happening in the first place, I say
hmm
do it.
hmm
Yeah,
Yeah.
100%. Yeah. Women birthing their babies are so scared of tearing and prolapse because it's become a norm almost to have one or both, after birthing your baby. And women live in pain for so many years after, as I was just saying. I think how we should be birthing our babies is still quite misunderstood. And women expect that if they go into the hospital, their care provider will provide them with all the things they need to have and, all the information they need to have so that these things won't happen. And that's unfortunately rarely the case. So thank you so much for coming on to talk to me about this. It's so great to have some real info that's not all jargon. I love talking about all these things and I've loved talking to you and learning, and I will definitely be implementing these things for my birth. So thank you so much for coming on, Jess.
Yeah, it's been my pleasure to be here, Barry. So thank you for inviting me.
Yeah, I know you have some really good resources.
Yeah, so on Instagram, that pelvic lady is my Instagram page. I give away all of the stuff for free. So you can look at some of my reels and some of the stories, and you can get a lot of this really helpful and supportive content absolutely free. We also do, for anybody who wants to take the free resources a step further, or if they're just feeling overwhelmed with all the
Yeah.
Instagram noise and the stats and the info and this freebie and that freebie. If you're feeling overwhelmed and you just want to get a very streamlined, structured program to walk you through it step by step, we do have some pretty affordable online resources as well at thatpelviclady.com. And even our Protect Your Pelvic Floor program costs just $24. So lots of
Mm,
really valuable and helpful information in there.
mm.
So yeah, I would encourage people to check out the freebies and or the paid support.
Amazing. Amazing. I would definitely be checking those out for
Yeah.
sure. If you're enjoying the podcast, make sure you give us a follow and rate the show. And if you think you know someone who needs to hear this episode, give it a share so we can spread the word and educate more mamas and women worldwide. And we'll see you next Monday for another juicy episode.